Good afternoon. It is my pleasure to contribute to the feminist dialogue and share my perspective. My name is NAMUKWAYA Winifred. I'm the leader of an organization of women with disabilities in Uganda, MUDIWA, and the vice chair of Disabled Women in Africa. Sexuality and reproductive rights exist on paper only for women and girls with disabilities in our context. The National Policy on SRH, revised in 2023 in Uganda, states that there is poor access of women with disabilities to sexual and reproductive health care, in particular due to lack of informational access and accessibility of facilities. Let me start by describing some challenges faced by women with disabilities. In rural and remote areas, SRH services are hard to reach. Clinics are far, costly, and rarely include outreaches targeting women and girls with disabilities. The health facilities themselves are often physically inaccessible. Communication barriers, lack of awareness among health workers, and negative attitude makes services far from inclusive. Many women with disabilities report being insulted or ignored by health staff who often address caregivers instead of them, violating their confidentiality and bodily autonomy. The DUA report for Beijing Plus 30 documented how women are subjected to verbal, psychological, and physical violence by health practitioners during childbirth, often without access to prenatal or postnatal care. MUDIWA and other organizations have also shared evidence with the UN Special Rapporteur on Violence Against Women. Many women shared that they were forced to give birth on the floor because maternity beds were inaccessible and had to remain there even after delivery. This is extremely risky, especially since many women with disabilities give birth through C-sections. The situation of women with psychosocial disabilities is equally alarming. In our study, supported by Making It Work, women described being tied on hospital beds, and many also faced forced contraception and sterilization, often at their family's request and with the doctor's approval. More of their stories are shared in our report, Echoes of Hope, and I invite you to read it. Stigma around sexuality and disability remains strong. Women with disabilities are often seen as sexual objects or the contrary, as targets for sexual exploitation and violence. Harmful practices persist, including men forcing women with disabilities into sex to supposedly cure AIDS and gain blessings. At the same time, girls with disabilities rarely receive sexual education. Those in schools are excluded from such sessions, while those out of schools are ignored by awareness campaigns. This lack of information exposes them to serious risks, including STI, HIV, and unintended pregnancies. So now, as I'm speaking to a wide audience of feminists involved in policy making, in development, and humanitarian aid, what can be done to change the situation? We need inclusion in SRHR. And inclusion is not just a word, it has to be intentional. It can be achieved only by consent. Talk to organizations of women with disabilities to understand their reality. Partner with them in your projects, whether in advocacy or service delivery. Include them in leadership. 1 in 5 women has a disability. That means 20% we are numerous. And our needs are huge as our capacity to act alongside feminist and women's rights defenders. Thank you.